The measles outbreak continues to be out of control in the United States, out of control in Pennsylvania. A lot of news in Pennsylvania over the past couple of days with these two measles related / measles associated deaths. A little bit of an update on what's going on there. So we know nothing about one of the cases. For the other case, we know from the Lancaster County coroner that this was a baby, a neonate that died shortly after birth and had a splenic laceration. What we now know is that the lung tissue of that baby was tested and is consistent with a measles infection prior to birth. So that raises a bunch of questions. One is, what were the circumstances of the birth? Did the mother have signs and symptoms of measles? Was the mother a measles case? Was she vaccinated against measles? What happened during the birth? Was it traumatic? Did they have to use instruments like forceps, for example? Where was the birth? Where did it occur? In a hospital or in some other type of facility? What was the baby like after it was born? Did it have signs of respiratory distress or pneumonia? All of those are important questions for which the answers need to be known in order to determine what role measles played in this child's death. And we need a lot more information about the second measles death, measles related death, because right now this information vacuum, which still exists, is being completely taken over by the anti-vaccine movement. And the fact that the State Department of Health is not having daily briefings, is not having people out there every day answering questions that are answerable, just adds fuel to this. A little bit about the splenic laceration. So from what I understand from the Philadelphia Inquirer's reporting, there is no splenomegaly, meaning no big spleen that was noted in this child that died. And splenomegaly is, I think, a rare complication of measles. There's a Polish study that's kind of floating around from around 2024 where 1/3 of the patients had clinical splenomegaly, meaning not on a CAT scan or an ultrasound, but they felt the spleen, I guess. And that seemed to be more common in older children than younger children. So this is something that has been reported in the literature. But again, they're saying that there wasn't splenomegaly here, a splenic laceration, presumably from a traumatic birth. We'll have to get more information because a lot of this is speculation. Multiple counties in Pennsylvania are reporting community spread. This is now, I think, regaining its endemicity in the state of Pennsylvania, and all counties, all 67, are eventually probably going to have to deal with it. There was an interesting article in the Post-Gazette where they interviewed a Mennonite woman, and she said that measles is just a fact of life they deal with. It doesn't have to be a fact of life. The MMR vaccine is what makes it a part of life that can be mastered. So you don't have to worry about this. So you don't have to speculate between measles related versus measles associated versus measles caused, because the MMR vaccine, that's the simple solution here.